You're listening to episode number 26 of the Nightingale podcast. This week, I am introducing something new to the Nightingale podcast called stat segments. And the fun thing about these stat segments are they are going to be occurring every other week of the podcast. So one week we will have a stat segment. The next week we will have a guest or a interview with another amazing nurse. But these just offer the chance to dive into a topic or a thought or a area that we might be struggling with in just a 15-minute 20-minute episode that we can just listen to on the go. And hopefully it'll be just a little bit of motivation, inspiration to get you thinking a little bit more about the topic. Before we dive in, I want to highlight our reviewer of the week. And this week's review comes from LIFHDY. Thank you. The title is Future RN at Student Nurse. It says, I am in love with this podcast. I love to hear all of Dakota's guests speak about their journey in their healthcare fields. Nursing is something I'm really passionate about, and it's intimidating. However, finding this podcast has made me feel less anxious and like I'm not alone. This review is perfect for this week's topic, and you are not alone in feeling that intimidation. It is common, it is normal, and we all have been there. And I just love that this podcast is allowing you to feel a little bit normal with that and just give you just some feelings of comfort knowing that we are all a big, huge tribe, especially in the nursing field and healthcare in general. So thank you for sharing this honest review, and I hope you find this week's episode very beneficial. As always, if you too are loving the Nightingale podcast, I would very much appreciate you leaving a rating or a review and sharing your honest thoughts about the podcast, and just sharing it with a friend so that we can get these stat segments and nursing interviews out into as many hands as possible so that we can share a little bit of that tribe vibe with other people so that we can just all feel that we aren't not alone in our thoughts and our struggles and our triumphs within this amazing profession. Hey friends, welcome to the Nightingale podcast. A podcast for nurses, future nurses, and, well, anyone interested in the nursing profession. I'm your host, Dakota Felkowski, RN, BSN, and DNP student. Join us each week as I interview nurses from all areas of the nursing profession to uncover nursing opportunities that you may have not known even existed. You can expect to be inspired and maybe even a little bit motivated. The goal of the Nightingale podcast is to encourage you to think outside of the box, step outside of that comfort zone of yours, and reach for a fulfilling and unique nursing journey. So let's dive in and check out this week's guest. You never know, they may just have your dream job. This week's stat segment, I want to talk about the topic of just feeling less than and always having that thought in the back of our minds like we aren't good enough, right? Don't we all do this at every stage in our journey as a student, as a new nurse, as somebody who is new to a department, or even just always when comparing ourselves to other professionals within the field? It is so common for us to have this feeling like we are not enough, or we're not enough of a nurse, we're not enough of a student, and we don't have the skills comparative to another person. And we let this story and this false myth of a situation to just play in our minds over and over and over. And guess what? It's only hurting us and our patients. It's just preventing us from living up to that full potential that we were meant to be in. And I just think that this is so important to talk about. And one thing that I wanted to discuss when coming to this is just the topic of having a shift in our mindset. So I know it is so easy to sit on the other side and have somebody from the outside looking into a situation say, oh, you just need to shift your perspective, or stop thinking that, like not justifying our feelings, like you have no reason to feel that way, fill in the blank of what your situation is. And so I recently was listening to a podcast episode. I love Lori Harder in the Earn Your Happy podcast, and she interviewed actually someone by the name of Todd Herman on her podcast, and it was called Activate Your Powerful Alter Ego. And Todd actually wrote a book on alter ego. So let's talk about the alter ego for a second. So to him, your alter ego is your opportunity to live into that full version of yourself, and to push aside those limiting beliefs about ourselves, and just to be who we were meant to be, and just to like kind of drop those beliefs. And so if you look at people like, say, Superman or Spider-Man, or all like the superheroes in general, they have this alter ego, right? So we have their one person without their kind of mask or their persona, and then they're a totally different person once they put that on. And we have the opportunity to do that with ourselves, whether it be a physical thing or with just a shift in your mindset or just a new thought process. So I love that they bring up this idea of having your alter ego. So I know for me, and I've witnessed this since I've been in the nursing profession, is that a lot of times, have you ever heard that phrase, you're just a nurse? So a lot of times, don't we hear that, or we say that to ourselves? Oh, I'm just a nurse, or I'm just a nurse practitioner, or I'm just a student, or I'm just a new graduate. And when we hear this, like, we're so used to this phrase, oh, I'm just a nurse. And we're like, yo, you're not just a nurse. And, we dive into that. And this is where this alter ego has to come into play for us to live out to this full potential. So I just love this idea. So within his book, I'm really excited to dive into more of his work, and his book, I guess, is just amazing. But I just think that this is such a awesome perspective for us to put on, is what is it that we want our alter ego to say? So what if we showed up with the mindset that we are a doctor? So I'm not saying it as we are going to come show up to work as doing something that's outside of our scope of practice. That's not at all what I'm saying, or to just be stepping over boundaries and things like that. No, I'm saying, what if we stepped into every single shift as kind of that top of the hierarchy? So what if we stepped in as our first day as a student nurse, and we stepped onto the unit in the mindset that we are an experienced nurse? What would that confidence look like for us? What would that confidence look like if we showed up to our shift as a nurse, or even as an experienced nurse, with the confidence that a doctor or provider must have? What if we showed up as our shift as a CRNA, as a nurse practitioner, or whatever it may be, or an educator, a manager? What if we showed up to that level of someone who excels in that position? What if we showed up with that confidence? What would that look like? Right? So if we brought forth that confidence, it would make huge impacts in our care and in our confidence and in our trajectory to just live out to the full potential. Because those limiting beliefs that we place on ourselves within any role that we're in, it's a false belief that we put on ourselves. And we have the chance to swap that out for something so empowering when we take on this thought process of my alter ego. So I want to share with you something that they talked about in this episode, and it's a really neat study that they discussed. And the study actually was done to kind of see what this thought process of the alter ego would play out as. So if we did a study on it and we looked and we saw what does a little shift in mindset look like as far as what happens when Superman puts on his cape, right? And so this actually has a term. It's called enclothed cognition. Enclothed cognition. It's a mouthful. And so what the study did was it actually had 3 different groups of people, of students, and they had to do a puzzle. So the puzzle that they were testing their time that it took for them to do the puzzle, how many errors they made when completing the puzzle. And the first group just went in and did the puzzle, okay? The second group was given a white lab coat and was told that it was a painter's coat. And so that same group did the puzzle. And what they found was really interesting. So that was the second group. The third group was given that same lab coat and given the same puzzle, and they were told that it was a lab coat or a doctor's coat. And the results were amazing. So the differences between the first group with no lab coat and the second group with the painter's lab coat, the results were the same. They did the puzzle in the same amount of time. And what is amazing about this situation is the third group, who was given the doctor's coat, actually did the puzzle in half the time, and they made way less errors on the puzzle. So I just find this so amazing because this just reinforces this whole idea of you with just one small change. They weren't given any different situation. They weren't given an easier puzzle, no change in puzzle. The only change was this white lab coat that they thought was told was a doctor's lab coat. And so right there, it put them in a different mindset. And so they were thinking like a doctor. They were thinking more critically. They were able to problem solve easier. So it's just awesome to see just what this experiment showed about this alter ego. So for us as nurses, future nurses, or people in the healthcare profession, what if we were able to do the same thing for ourselves every day? What if we were able to put on our stethoscope? We were able to put on our badge. We were able to put on something that was empowering to us. I mean, I remember that first time that I walked into clinical with my stethoscope around my neck, and I felt like I was the coolest person on the planet. You know, you have that feeling, or you walk around with your badge your first day as a nurse and you're like, oh, this officially says nurse. You know, that is so empowering. So what if we are able to, the first day that we embark on this new journey, what if we are able to take that badge and use it in the same way that these people did with this lab coat? That it gave them the confidence to say, I am not just a nurse. I am an experienced nurse. I am confident, and give you that confidence, because that's all it takes, right? So just going forward, I challenge us all, and myself included, to just go into every day at clinical, every day at school, every situation in the future, and think about that. What if we were able to put on that piece of equipment, of your badge, whatever it may be, and just have that feeling of confidence in the way that someone at the highest level would have? What confidence would that doctor have when they're walking into that patient's room or when communicating with other professionals? It's high, right? We always look at others and you say, oh, I wish I had their confidence, or I wish I had blank, when they're in those excelled stages of their profession. We can do that. We can mimic that. Yes, we obviously aren't going to start off as a novice and really truly be an expert, but if we have that confidence, we are going to continue to up that trajectory of living out to our full potential, and it's going to make us exponentially better at what we're doing. So I just found this topic so relatable, and just this idea of this alter ego, because I'm with you. I am in the same position as many of the listeners who listen to this podcast. I'm a student right now, and it's so easy for me to go into my patients' rooms and just feel like, oh, I'm just a nurse practitioner student, or I'm just this, and just feel like I'm not enough, just feel like, oh, my opinion doesn't matter or my skills don't matter. That's on me. When you walk into a room with confidence breeds like confidence, right? Confidence breeds confidence into our coworkers. It breeds confidence into our patients. So if we are able to put on that alter ego of, if you want your alter ego to be super nurse, if you want your alter ego to be Florence Nightingale, let's do it. There's nothing holding us back from that. So I love this idea, and I hope that this is something that we can all start to dive into a little bit further, and just think for yourself, is there something that is in your home? Is there a piece of memorabilia? Is there a piece of something from a relative from nursing school that gives you a feeling of confidence or just makes you feel empowered? Channel that person, channel that confidence, channel that situation, and that is going to start to build this alter ego that is going to make us so much of a better nurse and a better just healthcare provider in general. And I just love this idea. So if you are in this situation where you're like, yes, that's me, I'm on board, start dreaming up an alter ego. It's so fun, and I can't wait to hear where everyone goes with this. So I hope you all have enjoyed this first stat segment. It's been really fun, and I can't wait to just carry out these short segments in the future and just touch on important topics.
Thanks for listening to this week's episode of the Nightingale podcast. If you enjoyed this week's episode, make sure you subscribe so that you are getting weekly notifications when the new episode comes out. And while you are there, I would really appreciate you leaving a review, and maybe your review will be featured on an upcoming podcast. You can check out all episodes at thenightingalepodcast.com or on Facebook at The Nightingale Podcast.